So when I'm checking a myotomal assessment in the upper limb, shoulder abduction is C5, elbow flexion is C6 with wrist extension, elbow extension is C7 with wrist flexion, C8 is a finger flexion, and T1 is abduction adduction. Regarding the lower limb, hip flexion is L2, knee extension is L3, the foot dorsiflexion is L4, the big toe extension is L5, and hamstring is S1, or gastrosoleus is S1. When I grade a muscle power, if there is a full power, this is grade. Regarding the muscle power, grade 0 is grade 5 is the one which contracts at full range of motion, full power. Grade 4, some strength is reduced but can move against some resistance. Grade 3 is reduced and can be moved only against gravity. Grade 2 is the muscle power, which is movement which is possible when the gravity is removed. Grade 1 is some flicker, and grade 0 is when no movements and total paralysis. For sensations or dermatome, on the back of occiput is C2, below it is C3, and around the scapular region, interscapular region, is C4. Shoulder is C5. On the lateral aspect of elbow is C6. The thumb is C6. The middle finger is C7. The ulnar aspect is C8. And medial elbow is T1. Moreover, T4 is for nipples, T8 is xiphisternum, T10 is umbilicus. Anterior thigh is L2, anterior to knee is L3. Medial aspect of the calf is L4, lateral aspect is L5, and S1 is lateral aspect of the foot, and posterior aspect of the thigh is S2, and ischial tuberosity is S3, and perineal wipe is S4, S5. Regarding the reflexes, bicep reflex is C5, brachioradialis reflex is C6, tricep reflex is C7, that is for the upper limb. For the lower limb, cremasteric reflex is L1, knee jerk knee reflex is L3, and Achilles tendon reflex is S1.